asthma have any connection on the height and weight of the baby?
Yes, it does. So, in case if the child has poorly controlled symptoms, coughing a lot in the night, not getting the right medication, that is required, and without taking the right medications, or scared of inhalers, and taking a lot of oral steroids, and such children will have stunted growth in terms of less weight and less height. So, recognizing this problem early, taking your pediatrician's help, giving the right medication will get the weight and height back, the growth back to normal norms in no time. So understanding that this can be an important reason for your child's stunted growth is very important to consider.
Good God, that scares me, but also I'm feeling a little bit more aware, and I'm
I
sure.
also want to put this point forth that if the child is not sleeping in the night due to some disturbance like cough or some disturbances, so because of this, which is happening very constantly,
Understood.
the important hormones like growth hormone and insulin hormone and many important hormones are produced in the night when the baby is sleeping, or when the baby is in deep sleep or REM sleep. So if this cough is constantly disturbing this REM sleep, this is how it's going to affect the growth.
Okay. So, doctor, I want to understand, why is there an increase in asthma and lung-related issues in kids nowadays?
This is a very relevant concern, and almost every parent asks me this question. Why is this? Why are we seeing this more nowadays?
Correct.
When we were small, we never heard of this being a problem. So why is this happening a lot nowadays? Why is my child, being labeled this? So there are several reasons in this generation why there is an increased incidence of childhood asthma. It's because of rising pollution levels in the air.
Understood.
So if you see the air quality index in Bangalore in the last 1 month, so it's very poor. It's above 74, 75. So when the actual permissible levels is 50 and below 50. So this itself is telling that the very air that we breathe is polluted. And not only that, children are now interested in staying indoors, sticking to screens, watching TVs or playing video games, not having enough physical activity outside. And also now it's become a norm to have sand parks everywhere.
Correct.
In our apartments, in
Correct.
preschools,
Correct.
in schools, and even in malls, everywhere. So these sand parks or these sand
Bits, yeah.
particles, their pore size is very, very small. It's actually less than 5 microns. It is not the same sand particle pore size when we were small and when we were playing with the sand. It's a completely different ball game now with the invent of heavy machinery and everything.
It's
So
quite
this
fine.
sand dust, fine dust, just goes and sits inside one of the narrow, smallest breathing pipes and cause allergy around it.
Good God.
So sand parks are a problem. And also even your fabric-based play areas. Again, in malls we have a lot of fabric-based play areas. We even get that to our parties now, birthday parties and everywhere. So they are brooding with allergens. We need to stop that.